So we're gonna be doing a series of assessments on you, and then we'll progress to treatment. Just so we can know what the root cause of the, the pains you're having are, and then just so we can treat you better. Okay. Do I have your full consent to palpate, to treat?
Yes.
Sounds good. Okay. So what I'm gonna ask you to do is to just walk back and forth.
Okay.
Okay. Okay, come back up. Okay, you can just stay right there. And then the next thing that you want to do is called heel drop. So you just bounce on your heels. Okay. Now we're looking for pain, for any kind of feeling that is abnormal. Let me know if you feel anything different. Do you feel any pain?
I feel like I lean more into my left heel.
To your left heel? Okay, good. And now the next thing that you have to do is called the global flexion. So what you want to do is to come forward.
I instantly get tension in my low back and my hamstrings are fairly tight.
Okay.
And it pulls, the more further I go, it pulls all the way down into my calves and my heels.
Okay, sounds good. You can come back up. The next thing you want to do is global extension. So you want to just extend as if you're hugging the wall. Let me know if you feel anything in your back.
Yeah, right in the SI joint.
The SI joint? Okay, you can come back to neutral. Now we're going to move into circumduction. We're going to start with your legs. So I'm going to do it and then you repeat after me. So you just want to open out like you're, and then you want to bring it back in.
Ooh.
I hear the crack.
Yeah. Sorry. And yeah, I can't really balance on that left leg as much, and it did pop.
Yeah.
I can balance on my right side better though.
Yeah. Okay. So you felt pain when you do the right?
It's just really hard to balance
hard?
on this side. Like I favor it, I feel like.
Yeah. Okay. So the next thing we want to do is a shoulder circumduction. Same thing we did on the leg. Just now we're doing it on the shoulder.
There's some crepitus.
Okay.
You can hear that?
Yeah, I can hear that.
But this side's fine.
It's fine? Okay, maybe we'll try to bring it in this time. Good.
Yeah, that side's good. Just crepitus on this side.
Now I'm just gonna come behind you and I'm gonna place my hands on your trunk and then you're gonna rotate, okay?
I'll turn this.
Okay, good. Sounds good. So if you wanna put your hand around your, and I'm just gonna place my hands on your hip bone and I'm gonna ask you to rotate right and left. Do you feel anything when I do that?
Tension in the lower back.
The lower back.
When I rotate this way to that right side for sure.
Okay. Okay, you can go back to and now I'm gonna ask you to rotate your neck. So if you wanna look to one side and then the other side. And again, let me know if you feel any pain.
Less range of motion going this way. I do have history of whiplash on my right side.
Oh.
In 2020, I was in a car accident and I had a WOD 2 whiplash on my right side. So rotating this way is super easy. Rotating this way is very limited, it feels like. Like limited compared to what I have on this side.
Okay, so now I'm just gonna ask you to sit on the table. Now we have Raven seated on the table. Her feet are supported on the table and her knees are resting against the table. Now we're just gonna do the seated assessment. So I'm just gonna first of all stabilize her hip bone. Okay. Raven, if I can please ask you to put your hands across your chest. Okay, thank you. And now I'm gonna ask you to rotate one way, good, and then the other way.
Limited going this way for
Limited
sure.
going that way?
Yeah.
Good. And you have more room going to the right, right?
Yeah.
Good. Okay. So now I'm gonna ask you to just go into flexion position, just lean forward. Do you feel anything when you do that?
No.
Okay. Now you're gonna come back towards me just a little bit. Extension. Do you feel anything?
Yes.
Where do you feel?
The tension in the lower back.
tension in your lower back. Okay,
Yeah.
you can go back to neutral position. Thank you. And that's for the seated. Maybe we'll do one more. So maybe you rotate, you just turn one way and then the other.
Okay.
Okay.
So side bend.
Side bending, yeah. Okay, and then the other way. Do you feel anything when you do that?
This I feel in the SI joint. Side bending
Yeah.
and posterior. Yeah.
Okay. Good. Thank you. And now we're gonna move into T-line. So what I needed to do is to lie on the table so you will start supine. So we're gonna be continuing with the assessment, but now we're doing the T-line. So we're assessing your T-lines to see, you know, where you have discomfort. Okay.
Okay.
Raven, can you please pull down towards me a little bit? Okay, that's good. Thank you. Good. Try not to go too hard so the table doesn't move. Okay. Stabilize one leg. See a bit of restriction on the left when I do that. And now to the right side. So I see more movement going to your head on the right side. And now I'm just gonna do.
I feel that in my hip.
You feel it in your hips? Yeah. Okay. And you have more movement on this side. Yeah. Okay. Let's see. Do you feel anything when I do that?
A little bit in my hips that way.
From left hip.
And that way is fine.
It's fine on the right. Okay, good. Now I'm just gonna do the same one. We're just gonna be starting with the limbs assessment on wealth in the supine position. I want to start by palpating the lymph node on the side of the ear, which is the pre-auricular lymph node that is anterior of the ear. Okay, we're gonna be doing this bilaterally. So one and then the other. It's even. Next, we're gonna go behind the ear and palpate the retro-auricular lymph node. And this is just at the back of the ear, and it's proximal to the maxilla. And then the third one is just the submandibular lymph node, which is just under the jawline and is inferior to the mandible. And then we have the submeltar lymph node, which is just below the shin. The next one is the subclavicular lymph node, which we're going to be doing one side at a time because of the coracoid artery. We don't want to block that. And then the next one is the supraclavicular lymph node. Supraclavicular lymph node. And then we'll move down to the parasternal lymph node. Now we're just palpating to see if there is difference in the way the lymph nodes are palpating, like are pulsating, like the movement, if there is difference in any of the movement. But so far there is no difference. And then I'm just going to ask you to move his hand a little bit. Just move your hand out a little bit so I can palpate your axillary. Okay, that's good. Now we're just on the axillary lymph node. Okay, so the next one I'm just gonna come down to wet stomach and I will palpate the iliacus lymph node. Okay. The inguinal lymph node, which is just on top of the inguinal line. And then finally, I'm just gonna palpate the popliteal lymph node. So I just put my hand behind Welt's popliteal fossa. And of course, we want to be cautious of buccal cysts. Okay, so that's it for lymph nodes, some bony landmark in your body. You just have to let me know if you feel the same sensation as I do that, okay? I'm gonna start with your, okay. Okay. Go to this other side. Let me know if you feel the same sensation or different. Now I come to your tibial tuberosity. And then I come to your fibular head. Same sensation, no difference?
Yes.
Okay, that's good sign. And then I come to your lateral malleolus. And then your fifth metacarpal, metatarsal. Same sensation? Okay, good. What do you can pause? Just looking for the brachial artery. Put your hand in your fist. Okay, let go. There we go. Just stay still, okay? Okay. Come closer to me. Let's take it to 180. One or eight over 70. Okay. On your hands, do you have any pain, any surgery, past surgeries, any broken bones? Okay, good. If you want to pull up towards me a little bit. Perfect, thank you. Just take off the table a little bit here. And now I'm just gonna pull your hands and then pull the other one. More movement on this side. This is your right. More movement. Okay, thank you. I'm gonna move into Michelle testing. Okay? Good. So now we're gonna start with Michelle testing. We're looking for type 1, type 2 lesion, either found in flexion, extension, or in neutral position. So the first thing that I'm gonna be doing is to look for type 1 lesion in neutral position. Good. Still in neutral. I'm looking for type 2. Good. And now I'm just going to ask you to lean forward a little bit, so go into flexion position. Okay. I'll do that one more time because I did find something around your T4. Yeah.
I feel
Inflection.
pulling in that area.
You feel pulling on the right side?
Mm-hmm.
Okay, good. I'm just gonna take note of that. Good. Into flexion, so I can look for type 2. Okay, good. Good. I'll do that one more time. Okay, there's nothing in flexion. Type 2. Okay, now come back, lean backward a little bit in extension. I'll look for type 1. Nothing. I'll look for type 2. Nothing. Good. You can go back to neutral. So what we found is type 2 that was founded in flexion.
Mm-hmm.
Okay. So the next thing that we want to do, we want to check for high ear. So your right ear is higher than your left. And now we're gonna check for high shoulder. I see your right shoulder is higher than your left as well. Good. And now we're gonna check for the foot pressure. Where do you think you put more pressure more? Is it on your heel bone?
But my arch is like rolling.
It's rolling? Okay. And where do you think you have more pressure, your right or your left?
My right.
You lean towards more to your right?
Mm-hmm.
Okay. Foot pressure right. Good. And now we're looking for up sleep. See, if you want to please put your hands across your chest. Now I'm just going to put my hands on your hip bone, your iliac crest, and then I'll look for which one is higher. So we have the right side higher. Yeah, so we have the right, and now we'll look for up sleep. Again, I'm still gonna put my hands on your iliac crest, palpate for your PSISs, and now I'm gonna ask you to just lean forward while looking for up sleep. Okay, I see a little bit of movement on the left side. Let's do that one more time. Okay, good. So up sleep is left. Good. And now we're gonna do deep circles. Again, I put my hands on your iliac crest. Look for your PSISs. In the nickel, up the nickel. Just looking for the one that is higher. So deep circles is, just gonna pull this up a little bit. So PSISs, in the nickel, up the nickel. So deep circles is on the left. And now we'll look for the posterior rotation of the innominate, okay? So first, I'm gonna put my hands on your iliac crest, PSIS. And grab my chair. Yeah, put your hands on my shoulder, and I'm gonna ask you to lift your leg up. So what I find is this is not balanced. It can only be balanced with 3 fingers. Okay? So you have anterior rotation on your left side. Anterior pelvic rotation on the left. Okay. Yeah. So put your hand on me. Yeah, I need to look for your PSIS as well.
Okay.
Yeah. Perfect. Good. And now put your hand on my shoulder and then lift your leg up. Okay, that is good.
Quickie.
Okay. Okay, this one looks even. Yeah. So we have the anterior pelvic tilt on the left side. And now we're gonna look for bending knee. If you wanna go back into this position, good. And I'm gonna grab my chair one more time. So bending knee right. Okay. And now I'm gonna look for foot. I'm just looking at your feet now. Okay, so just continuing, I'm just gonna confirm which of your foot is more forward. So I see your left foot is more forward than your right. Okay. Just gonna take note of that. Left foot forward. Good. So now we're gonna move into seated for Michelle testing.
Okay.
Good. So the seated testing for Michelle.
Yeah.
Your seat are supported on the platform.
Yeah.
Your knees are resting on the table.
Yep.
You sit comfortable.
Yep.
Okay, good. So now we're just gonna look for type 1 in neutral position. Legion. Legions found in neutral position. So there is nothing. Now we'll look for type 2. There's nothing. Now I'm gonna ask you to put your head into flexion a little bit, come back up a little bit. Good. So in flexion on T4 I found like irritation. Let's see. Yeah. Keep moving downward, there's nothing. And then type 2, there's nothing. So I found right side rotation on T4. Okay, I'll just put that down. So come back into extension, look for type 1, there's nothing. And then type 2, there's nothing. I do that one more time, sorry. Type 2, there's nothing. Okay, good. And now you can go back into neutral position. And now we're just gonna look for high helium. If you wanna put your hands across your chest, please. So seated. Again, high helium, right, seated, and then up sleep. Okay, move forward. Okay, up sleep is on the left. Just confirming no sleep on the left. And then now we're looking for deep circles. First I look for the PS, the iliac crest, high helium. I look for PSIS. And I'm gonna ask you to please lean for, and I'm just gonna look for the deep circles. So deep circles is on the left side. Good. And now we're gonna move into prone. The Michelle testing with you lying prone. Raven, stand up first. Like, yeah, exactly, just stay like that. So what I needed to do, Raven, was starting the Michelle testing on prone position. I want you to put your head on your hand. So put your hand like a pillow. Yeah, so go down. No,
okay.
Exactly. Good. And pull back a little bit. And do I have your consent to stand in between your legs? Good. Perfect. Thank you. So now I'm gonna look for type 1 legion in neutral. There's nothing. And now I'll look for type 2 in neutral. There's nothing. And now I'm gonna ask you to put your shoulder on the table. Yeah, your elbow on the table. Yeah, and then pull backward a little bit. And now look for type 1. There's nothing. I'll look for type 2. So there's nothing when you lie prone. And now I'm gonna ask you to go into flexion. So pull your head down a little bit. Good. Now look for type 1. There's nothing. Now I'm looking for type 2. So nothing on this. So ilium is still high on the right side. In flare and out flare. So we have it on the right. Look for the eye helium, PSIS, in the nickel, up the nickel. We have deep circles on the left side. Now we're gonna look for the depression inferior lateral angle. I'm just gonna palpate on your sacrum right here.
Tender on the left.
Tender on the left.
Mm-hmm.
Good. Now I'm gonna ask you to lift your head up and then rotate to the right. And then to the left. Okay. So I found that on the left. Look for this one. That and that. Back up into extension. So your elbow on the table. Good. And now rotate to the left, to the right, and then to the left. Okay. Okay, you can go back onto the table. So, but this one is even. And now we're looking for sacrum rotation. And canton rotation. So your sacrum is notated because my hand went deep. Coccyx was not mutated. Coccyx is even. Coccyx is canton mutated. Still in supine position. We're just gonna look for inflare and heart flare. Okay. Okay, so that one is on the right side. And then pubic tubercle. I'm just gonna ask you to palpate for your pubic bone, and then I'll come in between your leg. Do I have your consent? Good. Okay, I'm just gonna put my hand right there. Okay, now you can let go. Good. So that is right on eye on the left side. Your leg length. I think your right leg to be higher. Measure testing. Supine. Now we're doing passive range of motion. Okay. I'm just gonna put your leg in 125 degree. Flexion there. And your leg back down. Hip flexion. Same thing now in 45 degree. Medial rotation. Let me know if you feel anything. Lateral rotation.
Pulls there.
You feel a pull? Okay, good. I'll bring your leg back down and I'll put it in favor position. Good. And then I'll do adduction. Good.
That pulls.
You feel a pull? Okay. Good. And now do the same thing on the other leg.
That
Reflection.
pulls on the hamstring.
I can feel that too. Lateral rotation. Medial rotation. I'll put your leg in the table. Ooh, look at the gap.
That's pulling.
The forearm, there's more room here. And then to the adduction. Restricted in there. Okay.
That pulls.
You feel a pull? This is more free.
No, it pulls tighter.
You feel it tighter? Okay, let's do that one more time.
Like they both equally pull, but this one pulls tighter.
Yeah, there's more room on this side. Yeah, this one is more restricted. Okay. And that's it for supine. Now we'll have you turn on your back, lie prone, and we'll do the great and trial. Okay, so put your hands on your head on your hands. And now we're still doing the passive. position. Good. I'll do the same thing on the other side. Less movement on this side. Okay. Resisted MET on supine. So if you want to please turn face up. So what you want to do, you want to resist my push, okay? So it's gonna be 10% effort for 5 seconds. Okay. So I'll take your leg up. Okay. So you want to resist me in here, okay? So we'll practice. So you put your leg down, okay, towards me, and it's gonna be 10% effort for 5 seconds. Okay. So now resist. Okay, good. Bring your leg into this, and now you want to resist me. Yeah. Okay. So let's practice. Relax. Okay. So you want to resist me 10% effort for 5 seconds. 1, 2, 3, 4, 5. Relax. Now, let's practice, okay? So 10% effort for 5 seconds. 1, 2, 3, 4, 5. Good. And now I'm going to put your leg on favor position. And then I'm going to stabilize your hip. And you want to resist me 10% effort for 5 seconds, okay? Let's go. 1, 2, 3, 4, 5. Relax. Do you feel any pain when you do any of those movements?
No. It was a good stretch on this one. I think you should do it again.
Okay.
Wink, wink.
Okay. Let's do that one more time. Okay. Now resist me. Okay, relax. I'm gonna put my hand in the middle, so what you want to do is to push towards me with it. Okay, go. 1, 2, 3, 4, 5. Relax. Now I'm gonna come to your knee, and you want to push towards me again. Let's go. 1, 2, 3, 4, 5. Relax. And now you want to push down towards me. 1, 2, 3, 4, 5. Relax. And then we'll do the other leg as well. 1, 2, 3, 4, 5. Relax. And now you want to, I'll do both, and then I'll do one after the other. So you want to push towards me up. So bring your knee up. 1, 2, 3, 4, 5. Okay. So now do the flex. 1, 2, 3, 4, 5. Okay. Dozy. 1, 2, 3, 5. So you can put your leg into flexion. And we'll practice again. So you want to pull towards, downward towards my hand. Okay, you want to go. 1, 2, 3, 4, 5. Relax. Good. This is the left side. So you want to pull out towards me. Okay, 1, 2, 3, 4, 5. Relax, and I will practice. Now you want to pull out. Let's go. 1, 2, 3, 4, 5. Relax. Good. Now put your leg into favor. Okay, I'll support your hip, and you want to pull up towards me. So practice. So you pull up. Okay. 1, 2, 3, 4, 5. Relax. Good. Let's do that one more time. 1, 2, 3, 4, 5. Relax. Good. Starting the prone MET for mission testing, functional assessment. We're going to be starting with the hip flexion, knee flex to 90 degrees, okay? So let's practice. You're going to be resisting me. You're going to be pulling towards me, okay? So let's go. 1, 2, 3, 4, 5. Good. And now we'll do the hip flexion at, like that's for Maurice. So now you want to pull down, okay? Okay, let's go. Pull down towards my hand. 1, 2, 3, 4, 5. Good. Relax. We'll do the other side. Again, 10% effort for 10 seconds. Okay, so you want to pull down towards my hand. Okay, 1 to go. 1, 2, 3, 4, 5. Relax. Now come this way and we'll do. Okay, so you want to pull down towards me. 1, 2, 3, 4, 5. Relax. Good. Any pain there?
On the left side, yep.
On the left side. We're just getting into treatment, section. I'm just gonna be doing a global treatment on you starting. Okay. Does that feel okay?
Mm-hmm.
Good. Okay. Do it on this side. Good. So that is our first treatment. Now I'm just going to ask you to lay on your left side, okay, with your left leg straight out and your right leg bent.
Mm-hmm.
Your hand on your chest. And now I'm going to palpate for your deep circles on the left side.
Mm-hmm.
Okay. And now I'm going to roll you over. Good. Until I feel the deep circles pop into my hand.
Mm-hmm.
Okay. And now you're just gonna resist me. You're just gonna resist my hand. 10% effort for 10 seconds. Okay. So you wanna push towards me over here. Okay.
Mm-hmm.
Okay. Now let's go. 1, 2, 3, 4, 5. Relax. One more time. So push towards me. 1, 2, 3, 4, 5. Relax. Good. Let's do that one more time. Again. Relax. Okay. So now you're gonna come back into, that was a deep circus treatment. Ready in supine.
Mm-hmm.
I'm just gonna ask you to fold your legs.
Mm-hmm.
Okay. And then we're gonna practice. So now we're gonna do the shotgun. So you wanna push towards me. 10% effort for 10 seconds.
Mm-hmm.
Okay. So let's go. Okay. Relax.
Mm-hmm.
One more time. Relax. One more time. Good. And now you're gonna resist me. Okay. Relax. One more time. Relax. There we go. Good. Okay, you can put your leg back down. So that was the shotgun treatment. We're done with all 3 treatments. The shotgun, which is for local, the up sleeve, which is for focal, and then we also did the deep circle treatment, which is a global treatment. Okay, now I'm just gonna ask you to please stand up ready, and then we'll reassess. You can put your hands across your chest, and now we'll palpate to look for high helium. Your helium looks pretty even now. And now PSIS, they look even. I'll look for deep circles, PSIS in the nickel, up the nickel, they look even. And now I'm looking for up sleep. I'm just gonna ask you to lean forward. You can see they look even as well.
No pain either.
You don't have any pain? That's amazing. And now I'm just gonna look for the right anterior pelvic T that we had before. I'm gonna ask you to lift your leg up. Yeah, okay, that is good. You can see that it's even, and I'm gonna ask you to rotate. That's your PSIS, and this is your ASIS. Okay, now lift your leg up. That look even as well. So everything is corrected and treatment is done. You're good to go.
Perfect.
Thank you so much. And now, Raven, I'm just gonna check your pubic symphysis again. If you wanna please palpate. Good, thank you. Okay, you can let go. Okay, this is pretty even. That's good. And then I'll check this. That went down a little bit more. Yeah, that looks even. What else can we check for? Okay, let's check for the full bar. Okay, this is way better. Yeah, that was the problem side, and that was really better. Yeah, I can still feel a difference on this side as well. Good. Good. Thank you so much, Raven. Do you have any questions, any concerns?
No, that's great. Thank you.
That's good. You're welcome.